In the swirling winds of America's policy debates, few programs stand as tall or as targeted as Medicaid. What was once a quiet safety net has now become the front line in a political war over healthcare, immigration, and the federal budget. Before we get too far in, take a moment to share this video with anyone who relies on Medicaid or cares about our public healthcare system, because what's happening now could change everything, especially for the most vulnerable among us. Let's be clear, Medicaid isn't some fringe program. As of January 2025, 77% of Americans, yes, 3 out of 4, view it favorably. That includes not just Democrats, 93%, and independents, 83%, but a strong 74% of Republicans as well. And when it comes to cutting Medicaid, the story sharpens. 67% of Americans oppose reductions, and just 8% support any cuts at all. A May poll even showed 79% would reject candidates who vote to slash the program. Despite that, proposed legislation, most notably the GOP-led One Big Beautiful Bill Act, includes drastic cuts, totaling up to $880 billion over 10 years. According to analysts, that could strip healthcare from more than 10 million Americans, hitting rural communities and mental health services particularly hard. A bipartisan worry emerging from X, formerly Twitter, is mental health. A NAMI Ipsos poll shows that 78% believe Medicaid saves lives through access to mental health care. 85% want mental health services protected in any budget conversation. That message, echoed by both voters and advocacy groups, highlights the real-world stakes. Medicaid isn't abstract. It's emergency rooms, addiction clinics, prenatal visits, and nursing homes. While there's bipartisan love for the program, there are deep partisan differences in policy outlook. Republicans are more likely to support work requirements, with 68% of GOP voters in favor, but when informed that most Medicaid recipients already work, support for those requirements drops to just 35%. Add to that a fog of misinformation. Many Americans don't realize Medicaid covers long-term care. Fewer still know that most recipients are employed, or that undocumented immigrants aren't eligible for full federal benefits despite rampant myths to the contrary. So why is Medicaid trending now? It's the convergence of federal and state-level actions. The One Big Beautiful Bill is one front, but in states like Idaho and Montana, moves are being made to roll back Medicaid expansion entirely, putting millions at risk. Meanwhile, campaigns like NAMI's Protect Medicaid, Protect Mental Health are pushing back alongside House Democrats and even some Republicans who view the proposed cuts as politically radioactive. Online posts reveal a divided yet protective public. Most users express fear about what the proposed cuts would do to their families, to their rural hospitals, and to their communities. Others echo falsehoods about fraud or overuse. But the loudest message, cutting across ideology, don't mess with Medicaid. Whether you're a lawmaker, a voter, or someone just trying to make it through the week, Medicaid matters. It's the healthcare backbone for 1 in 5 Americans, and the debate around it will define the moral and political character of the next Congress. If you believe healthcare should never be weaponized, now's the time to speak up. Share this report. Contact your senators. Stay informed. Because while the numbers are staggering, the consequences are personal.